Hello everybody, Dr. Brown here. I was asked by a number of our patients to help with our cervical spine with the neck. So I asked first with Dr. Mariano Roccabato, give credit to him. Secondarily, credit to my good friend Dr. Logan Cooper, Doctor of Physical Therapy. What we're doing now is a stretch of the neck in order to reduce the slouch forward effect that a lot of us have. So what I'd like you to try to do, this is something you could do a number of times every day. Grab the back of your neck like this, sideways again, and pull straight up and tip forward just a little bit. I'm not talking this, I'm talking this. Very subtle, this much forward. When you look down at the ground as you do a slight tip forward and just hold there for a moment. Then you breathe in through your nose, and as you breathe out through your mouth, you hold that tipped forward position and release the pressure on the back of the neck. This is going to stretch C1 and C2 and open up the spaces back there a little bit more. It will also begin to improve the posture and get the neck straighter. The purpose of this exercise also is to improve the curvature of your neck, the lordosis. Most people have a perfectly straight neck like this that I've been meeting. We should have a little curvature to that neck. This helps reinstate the curvature. So again, you pull straight up, look to the ground and tip a tiny bit forward. And as you hold that, breathe in through the nose, out through the mouth, and release the hands while you're still looking down. This will likely cause some discomfort in the C spine, the cervical spine for the next few days. But it's an exercise that's very important to reduce the tech neck, the forward head posture, to get realignment of the cervical spine. And as always, you're probably wise to work with your physical therapist or osteopath to make it even better and get the whole body lined up. Thank you for your time.